Myself, Dr. Nirmala, had a chief complaint of hyperpigmentation over my face and extending to the neck since 4 years. Consulted many dermatologists. They suggested me with topical application, laser treatment and chemical peelings, which was not of much satisfactory. Then the investigation was carried out where they diagnosed it as lichen planus pigmentosus. Since the hypopigmentation was so deep involving the dermal layer, myself being a doctor, my patients started questioning regarding the same. Because of this, my confidence was affected and I started to get the treatment as early as possible. One of my sister's friend who had the same complaint of hyperpigmentation had a satisfactory result with Cosmoderma. She suggested me to consult the team of doctors at Cosmoderma.
Dr. Nirmala came to us approximately about 6 months ago, and when she came to us, she had a lot of pigmentation on her face, which was diffuse. So it had on her forehead, cheek, the nasolabial area, around the mouth, neck and upper part of the chest. And she also had lost a lot of hope because she'd had a lot of treatments in terms of peels, lasers, topical therapy, oral therapy, etc. at various different doctors and clinics across the city for about 3 years' time. And she hadn't seen a difference. And so she felt that it really wouldn't work, and she came to us based on a recommendation from a friend of hers who'd had treatment with us. So when we examined her, what we did was first we saw the depth of the pigmentation, and we did a 3D facial analysis which was able to predict how much of the pigment is there and in which layer of the skin, and if there is also a redness factor which will cause recurrence. And based on all of this, we were able to analyze that she had very deep pigmentation which was diffuse, and we had to take a long-term plan and approach and look at something like a sunscreen, complete sunscreen if possible.
So we analyzed her skin in detail with a 3D analysis, and we came up with a treatment plan to hydrate her skin and use the appropriate lasers for her skin type, which are US FDA approved.
The importance of all of this was it's a combination treatment because we had to hydrate one area and we had to remove the pigment without damaging the skin. And when Dr. Nirmala told her, she said she's in full-time practice, she can't afford to take time out, and she didn't want any downtime. So this is how we started, and we've had great results in treating LPP and diffuse hyperpigmentation just because of the sheer quality of treatment and the personalization of the treatment plan that we do at Cosmoderma clinics. And along with this, we also included some home care, which is very important. People forget that taking care of your skin at home is just as important as what you do at clinic. So we added Skin Bright capsules, which has polypodium in it, which offers some amount of oral sunscreen-like activity, so it increases your immunity to the sun. This was very essential along with the Skin Bright serum, which is a vitamin C based serum from L-ascorbic acid. So these two were very critical in our treatment skincare protocol. So with all of this and availability of excellent healthcare facilities at our clinic, we were able to deliver results.
I've been visiting Cosmoderma since 6 months and I gradually noticed my skin getting lightened. I thank Dr. Chytra and her team for making me feel happy and confident.